Lots of press stories about it, absolutely. Actually, funnily enough, yesterday morning I was looking at the information that had been provided in terms of advice, and the advice said very clearly, we do not advise pregnant women at this stage to have the injection. That's a standard thing for all vaccines and standard thing actually for a lot of medication as well. It also said we do not advise people who've had serious allergic reactions, i.e. requiring hospital care, to take the vaccine at this time.
Right, so we're not talking about hay fever or mild allergies to house dust here?
No, you should have ended up in hospital. Maybe someone's given you an EpiPen because you've had a very severe reaction. I was therefore surprised by the reports that said 2 workers who had EpiPens had been given the injection, which actually directly contradicts the guidance that had been produced. Now, to be fair, the guidance is coming out in a huge torrent and is coming out over the last couple of days, so I can only assume people hadn't read that particular guidance. As I say, it's fairly standard that you try to avoid it.
Now, this is only one of several vaccines in production. I imagine that other vaccines won't have an issue for allergy sufferers.
I'm sure there will be. I think the key thing in terms of the guidance says don't give it as the first line, but we can give it with a fair degree of support. So for those individuals, we would endeavour to provide that support or provide an alternative. Unfortunately, I don't have a crystal ball. I can't tell you exactly when these vaccines will be available. I can't say which ones are the most useful. We know the one that we've been given is very good for producing a type of immunity that's related to antibody production. This is the light at the end of this horrendous year tunnel, and let's all do the best we can to get us to the hallowed ground of a normality that we all crave. I know there's a lot of COVID fatigue. Surely this is the way, this is the answer. Now, who wants to be first? I will be first, and I'm sure other leading lights in Gibraltar would want to show that this is safe and it is reliable and it will give you immunity. And I suspect over the coming months, as countries start to say we want not just a yellow fever certificate, we want a COVID-free certificate, that people will see why and how it will be helpful to them.
So do you have an idea of when you'll be able to roll the vaccine out here in Gibraltar?
Again, the best information I had, and I'm obtaining my information through the UCOT team, the UK Overseas Territories team of Public Health England. They had actually originally promised us first or second week of December. It appears now that they're saying the first or second week of January. We're not sitting on our hands, however. There's been a vaccine action team formed in the GHA. We have and are developing a plan so that when the vaccine does come, we will go and blitz this over 4 to 6 weeks and try to get as much of our population done and protected as possible. You need 2 doses, 3 weeks apart. Your immunity only starts 7 days after you've had the second injection.